This lecture is going to be on causes of neutropenia. The two main causes of neutropenia are inflammation and decreased neutrophil production. With severe inflammation, the tissue demand for neutrophils can be very high, and this demand can actually exceed the bone marrow's ability to make neutrophils. And this type of inflammation can occur in any animal. However, in ruminants, inflammatory neutropenia is a normal response to acute inflammation, and this is because ruminants have a very small storage pool of neutrophils. Decreased production neutropenia occurs with primary bone marrow disease. In cases of severe tissue inflammation, the inflammation can be so severe that it calls on lots of neutrophils from the blood. And it calls on so many neutrophils that the movement of neutrophils into tissues exceeds that movement from the bone marrow into blood, even if the bone marrow is hyperplastic. So this type of inflammation is termed overwhelming inflammation, and that's because the bone marrow is overwhelmed by the degree of the inflammation. Animals with overwhelming inflammation tend to have a poor prognosis, and this is because this type of inflammation occurs more frequently with severe inflammatory diseases such as sepsis. Supporting evidence for severe inflammatory neutropenia includes the presence of toxic neutrophils or a left shift, and oftentimes the left shifts goes back to neutrophil stages earlier than bands, such as metamyelocytes and myelocytes. There are three types of left shifts, and they are listed here. A degenerative left shift is the type of left shift that indicates overwhelming inflammation. And remember, overwhelming inflammation was presented on the previous slide. A degenerative left shift may occur when there is neutropenia with a left shift, so low numbers of neutrophils with a left shift, or degenerative left shift can occur when the number of immature neutrophils exceeds the number of segmented or mature neutrophils. A regenerative left shift is any left shift that is not degenerative. A deep left shift occurs when there are stages of neutrophils earlier than band neutrophils. So most commonly, these are metamyelocytes or myelocytes. Like a degenerative left shift, a deep left shift tends to occur more frequently with severe inflammation. Inflammatory neutropenia does not necessarily denote overwhelming inflammation in ruminants, and that's because neutropenia may occur with acute inflammation of any severity in a ruminant, and that's a normal ruminant response. And this is because ruminants have a very small storage pool of neutrophils, so inflammation of any severity rapidly depletes that small storage pool. However, if the inflammation persists, then the bone marrow will undergo hyperplasia, and you would expect the neutrophils to return within the normal reference interval or be increased above the reference interval, typically within 3 to 7 days. Support for evidence of this type of neutropenia would be other evidence of inflammation, so band neutrophils, toxic neutrophils, and also evidence that this is an acute disease in a ruminant. So lymphopenia, an acute history of onset of disease, or if you do sequential CBCs, there's improvement of the neutropenia to within normal limits or above normal limits within 3 to 7 days. Decreased production neutropenia is a primary bone marrow disease in which neutrophil production is abnormal or absent within the bone marrow. Occasionally, just neutrophils are affected, but more commonly, production of all cell lineages are also affected, and this results in concurrent thrombocytopenia with or without a non-regenerative anemia. However, the onset of the decreases in the cell concentration depends on the circulating lifespan of each cell. So since neutrophils only circulate for a couple of hours, they tend to decrease first, with diseases that cause decreased production of all cell lines. Platelets circulate for days, so they tend to decrease second. And red blood cells circulate for months, so they'll decrease third. If decreased neutrophil production is suspected, then there may be historical or physical exam findings that support toxicity or damage to hematopoietic cells. So this includes infection with FELV in cats, parvovirus or Ehrlichia canis infection in dogs, or exposure to certain drugs or toxins such as estrogen. Neoplasia or inflammation within the bone marrow, termed myelitis, can also cause decreased hematopoietic cell production, and this is because these neoplastic or inflammatory cells crowd out the normal hematopoietic cells.